Um, breast reduction, as the name suggests, is to reduce the size of the breast. Whoever's seeking the breast reduction will have three elements that needs to be addressed. The size, which is the volume, which is the breast tissue, the envelope, which is the skin which is covering the breast tissue, and the areola, which is the colored skin, which is around the nipple. So normally when we do a reduction, we have to remove the volume, reduce the skin, and probably reduce the areola if they are large. And it's usually done when patient usually finish their family, most of the time. Sometimes if they're fairly large or troublesome in a younger age, it could be considered. And it's done under general anesthetic in an inpatient setting on most of the occasion. Certainly, there will be some effect after breast reduction surgery in the ability of women to breastfeed. This is due to the fact that we make incisions around the breast tissue and the gland tissue as well as the ducts. Therefore, the amount of breast that can get to the nipple may be significantly reduced. And therefore, most of the women who have breast reduction would not be able to breastfeed adequately. Some of them may not be able to breastfeed at all. Normally, patients seeking breast reduction, they come because they have a fairly large breast for their frame, their body frame. They carry a large amount of weight on their shoulder. And the problem associated with those are the back pain, neck pain, inability to find the right clothing. So if you take an average breast size in a fit young woman, anywhere between a C and a D cup is unacceptable. So anybody over and above that could qualify for breast reduction. Now, we should not confuse a breast reduction with a breast uplift. A lot of women who have droopy breast, which is more of a saggy breast, may think that they need a reduction. But if you look at them, they have a small volume, large amount of skin. Therefore, we have to tighten the skin, which is a different operation. But when we do the breast reduction, we automatically remove the breast tissue as well as tighten the skin. So they get an uplift effect as well. So there's slight variation between the pure uplift versus reduction. And therefore, reduction usually done for women who have a fairly large breast, most of the time over a D cup breast. Yes, of course. When we take into consideration for breast reduction, we take into consideration number of factors: how tall, what's their chest width, how far the nipple is from their neck. We would advise them what will fit their profile. There are some women seek advice to have a breast that is fairly small without realizing the chest width make a difference. If you make it too small, it would not look natural. So yes, there is an element of patient involvement, and we work with the patient to see what they require, what is appropriate for their build. It's a good question, though. What is the breast tissue? The breast tissue has got two parts to it. If you look at the young women breasts who are premenopausal, they would have a lot of breast gland, which is a glandular tissue which secretes milk, plus fat. If you look at women, older women, who may have more fat tissue than the breast glands. Now, when you perform a breast reduction, you are removing both fat and the gland. The gland tissue you remove, it's very unlikely to grow back to the level it was unless they become pregnant, because then there is an element of growth attached to it. Whereas the fat can grow. As we know, we can put weight on. So if somebody had a breast tissue removal along with the big breast with a fat excision or fat reduction, and if they went on to put weight, there is a likelihood the breast can change into slightly bigger than what they have after the surgery. Pain is something variable to person to person. It is tender and bit sore in most of the women for first 3 or 4 days. But it is reasonably managed with standard pain relief medication. In other words, most of the women who have had breast reduction were up and about walking day one, become pretty much normal in 1 week time without needing any major pain relief. Recovery period from breast reduction varies person to person. That depends on a number of factors. Most of the time, first week, they pretty much take it easy. Second week, they probably start doing normal activities. As long as they're pain-free, they should be able to drive. By third and fourth week, if everything is reasonably healed, they're back to most of the activities. By 6 to 8 weeks, they should be back to normal.